Good morning, ma'am. I am Rachel Dincornes Tagalak, your student nurse from Pamagkasan ng Luzon ng San Pablo. May I know your full name po, ma'am? And your birthday? Okay. And may I look at your wristband for further verification? Thank you. So, Ma'am Rochelle, I am here po to assist you in your labor and delivery. So, this is called intrapartum care. The purpose of intrapartum care is to ensure the safety and well-being of the mother and the newborn throughout the labor and delivery, managing any complications that arise, and promoting a well-guided birth outcomes. So, ma'am, may I know what language do you prefer to use? Okay po, then let's use Taglish. Before doing that, let me just inform you that this process includes seeing and touching some of your body parts. Before proceeding to the procedure, let me just close the windows to ensure your privacy. Before doing any procedure, hand washing or hand hygiene must be observed. Before touching a patient, before doing the procedure, after doing the procedure, after touching the patient, and before touching the patient's surroundings. So assume that I have properly worn my personal protective equipment, including the gown, the mask, the glasses, and the gloves.
Before anything else, reviewing the patient's prenatal records and history is a must. Assess the patient's vital signs and pain level to have a basis of her condition. Don't forget to take note and record immediately the results of her vital signs.
Ma'am Rochelle, can you please lie down because I will perform a detailed obstetric history and physical examination.
Assist the patient and guide her in her movements. Slightly tilt the back to avoid supine hypotensive syndrome. Perform Leopold's maneuver using the palm and not your fingers. Carefully trace the puntic height using the centimeters of the measuring tape. Record immediately the results of the examinations. Conduct a vaginal examination to assess cervical dilation, effacement, and fetal position.
So, ma'am, based on my examination, I have observed that the fetal positioning is right occipito posterior, and the effacement of your cervix is 70% effaced. The consistency of your cervix is soft, and the dilation is 4 centimeters dilated. So, we will wait for your labor until your cervix is 10 centimeters dilated before the delivery. So, ma'am, while monitoring your labor and your vital signs, I have to put an IV line and start the fluid flowing. So, Ma'am Rochelle, while you are in the process of labor, try to calm yourself and do not panic. I suggest you must have a proper breathing technique that will help you to calm and that will help your body to minimize complications. I also suggest that you must do the proper exercises such as squatting and the circle ball exercise. You must walk around the hall while you're in the process of your labor and ask your companion or your family to do an effleurage massage at your back. So we also need to ensure that your bladder is empty. So whether you feel the urination, you must go to the bathroom and empty your bladder. Or if you are not able to go to the bathroom, just ask the nurses outside or me as your nurse to catheterize your urethra.
Prepare the sterile instruments and ensure the neonatal resuscitation is readily functioning. Assist the patient into lithotomy position. Conduct a final vaginal examination to confirm full dilation and effacement.
Midwife, the patient is ready to begin pushing.
Provide perineal support to prevent tears. Now be prepared for the delivery of the baby.
I know you can do it. Keep pushing until the baby's head is out.
Monitor and document the frequency, strength, and duration of contractions every 10 minutes and record it into the partograph. Do a sterile vaginal examination. Note for the presence or absence of bulging bowel
There's no presence of K-pot, mold, and asynctylism.
and determine the engagement, position, effacement, and cervical dilation. Don't forget to note the cardinal movements of the delivery. During the engagement, the fetal head enters the pelvic inlet at the level of the ischial spines. The fetus moves downward through the birth canal due to uterine contractions and maternal pushing. The head naturally flexes, bringing the chin towards the chest. Internal rotation allows the back of the head to face the pubic symphysis. The forehead, nose, mouth, and chin will be delivered in sequence. The head rotates back to its original transverse position after the delivery. After the shoulders, the baby's body follows quickly, which completes the delivery. While the others are doing the neonatal care, the 10 units of oxytocin is being prepared and readily injected via intramuscular to the mother's deltoid. After the delivery, inspect the placenta and membranes for completeness.
Ma'am, please empty your bladder first because we will assess for your uterine tone. Okay, now ma'am, position in a supine position where your back is lying on the bed. And can you please slightly flex your knees? Okay. Now we will listen to your uterine tone. Okay ma'am, it's done na po.
Monitor for 24 hours and educate the patient as it is part of the
There's no
postpartum care.
postpartum hemorrhages in your vagina. Okay, ma'am, after giving birth, please allow your body to rest and recover to its fullest. And sleep can be challenging sometimes, but wait for the right time because your sleep will be alright soon. It is normal to feel sad, anxious, or irritable, but you can always talk to your family to feel good. And please wait for the bleeding to stop before you continue sexual intercourse activities. And then expect soreness on your vagina and discharge and contractions and other physical changes to your body. The midwife will teach you on how to properly breastfeed the baby, and some tips to take care of the baby properly. And if you do have any questions, you can ask me and I will answer you honestly. Thank you so much for your cooperation, Ma'am Rochelle. I have explained the holistic nursing care to the patient and its relation to the patient. I have documented all the necessary information and I have responded to the questions and scenario properly. After doing all the procedures, I must remove the face mask and my personal protective equipments after I leave the door. So by removing, we will start first with the gloves and dispose it properly. Next, I will remove my personal protective gown and dispose it also in the yellow bin. Next is the goggles and the face mask. Next, I have to observe the proper hand washing because it is essential after doing the procedure with the patient.
That's all for my performance in intrapartum care. Thank you so much for watching.
So,